Well, our next presentation is an update on Ebola, in case there's anyone in the room who hasn't heard enough about it lately. But before I turn it over to Eric, I found a documentary video from the Centers for Disease Control that will help put Ebola in perspective. Bill, take it away.
I'm actually okay. I am okay.
How are you doing? Because Ebola, man, hit New York. How are you handling it?
I'm here. Ebola's here. It's, you know what, though? I'm going to be totally honest with you because I'm known for being a germaphobe. I am okay. First, can I be totally honest with you? Number one, because I'm such a germaphobe, I feel like the whole world has come to my level. So I'm amongst... That's why not one person as I came out extended their hand. Not one. I love this world. It is my heaven. Number two, I think it's ridiculous. There are more Jews in the NFL than people who have died of Ebola in this country, right?
That is true.
That is true. One person has died. You can't get it. You can't get it. All the people who got it are the people. I'm not going to sponge bathe an Ebola patient. There's no way that I'm going to get it. The truth is, nobody's got it that way, right? Nobody's got it in the air. And it's just the silliness of the caregivers, who are wonderful and angels.
Right,
they're
yes,
silly,
they are
though.
angels.
Aren't they silly, though?
Well, they're angels.
You take care of an Ebola patient. The first one passed away, I'm sorry, and my heart goes out. And then the nurse, the first symptom is an insatiable desire to travel. She wants to take a flight to Cleveland. And she called the CDC and said, you know, I've got a fever. I've been looking after an Ebola patient. Should I fly to Cleveland? And they said, get a flight now. Now, the next... Wait. The next nurse called the CDC and they said, oh, don't get on a plane. Take a cruise. Then, the guy comes to New York. This guy's been looking after. He doesn't feel well for a couple days. Where does he go? Eboling. He goes Eboling. What is with if you've been touching the fluid of Ebola patients, just hang out at home for a little while. But we can't get it. We're never going to get it. My heart goes out to all the people that get it. So I'm not worried. I've never been more comfortable. I'm amongst the people. I feel fantastic. Oh my God. Nobody's reaching out. No, but I love this. I love New York. The other thing I don't understand...
I feel like you are really testing our luck. I feel like we're about to be struck by something.
No, but even the headlines here say Ebola comes to New York. Did you see what the CDC said? They said that they opened up, if you're coming from West Africa, the only airport that they'll allow you is New York. What? Why did they? So, of course it's here. You have to come in through New York. And if that's not enough, they opened up O'Hare, Chicago. They went to the busiest airports to let Ebola.
I know. It's so funny because when I woke up this morning, I knew you were coming on the show. We always get so excited to see you. And I woke up and that was the headline of the newspaper.
But it's
and
okay.
I went,
don't worry. Anybody, don't worry. If I'm okay, you're okay.
Eric is now open for questions. He says we've just done his update. Eric Rudnick is the medical director for NorCal EMS and for the Santa Clara County EMS agency and a paramedic program or two. He and I have traveled together a lot. We've been road warriors, teaching ICS, teaching disaster medical stuff. And I can tell you from personal experience, yes, he does hog the covers, but at least his feet aren't cold. But anyway, Dr. Eric Rudnick.
Well, top of the morning to y'all. Welcome to Ebola Coaster. Yes, indeedy, that is all I have done for the last month. My real work, you can't see me on I'm hidden by all the work that's on my desk right now. So, we're going to talk about Ebola 101. It's current as of today. And the reason why I say that is it's a pretty fluid and dynamic, I just found the clicker, fluid and dynamic process going on. as far as the number of people who have got it and perished. There's about 10,000 people who have gotten Ebola, and about 5,000 have perished, mostly in Western Africa. The chances of any of our providers encountering a Ebola patient is pretty darn slim to nil. That said, we are using this as a emerging infectious disease training. You as providers are significantly more likely to get exposed and catch tuberculosis, hepatitis C, hepatitis B. The enterovirus EV68 that was ravishing the Midwest with the adolescents is in California right now. So, without further ado, as I said, this is for today. It's dynamic. I want to give a big shout out, thank you to Dr. Sarah Cody and Dr. George Hahn, who are two of the health officers in Santa Clara County. We've been working hand in hand. There are new practices coming out next week by MDAC, which is the Medical Directors of California, EMS Medical Directors of California, MSAC, which are the administrators, and EMSA, Emergency Medical Services Authority. So we're going to give a little overview of West Africa, the symptoms, transmission, and how we are planning. I'm going to move pretty quickly. So Ebola is one of 3 viral hemorrhagic fevers. I remember learning about these back in 1987 in microbiology. Yes, I'm old. I had the thought that, damn, I don't want to get one of these, and wow, I'm glad it's not in the States. I'll never see a case. I'll never have to think about it ever again. Oh well, I was wrong. The big thing is the fever has changed. The CDC initially said 101.5 or 38.4 degrees Celsius. It's now down to 100.4. Fever is the hallmark. Body aches, headache, malaise, nausea, vomiting, and diarrhea are later symptoms. So, again, it's got a 2-day to 21-day incubation period. So the thing is, these patients, like Dr. Spencer, who returned from, I do believe he was in Guinea, in New York City, was not infectious while he was making his rounds, bowling, eating at restaurants. He was very careful, took his temperature, and when he had 100.3, he called, and he got isolated. So, again, Ebola is not airborne, at least not currently their current thought process. Now, if I went, and I had measles, well, guys, the first 3 rows just got measles. Because measles is airborne. Chickenpox is airborne. The little viruses float on the air currents. Now, you can get Ebola from droplets, which is significantly different than airborne. Airborne is where the little virus particles float on the air. Droplets is when you have all that lovely mucus when you're sick and you're coughing and you're sneezing. And then droplets are heavy, relatively speaking. They fall down within about 3 feet. You know, people are, at least in my opinion, are overreacting, but as I said earlier, we in EMS have been terrible with infectious diseases. When I do ride-along time, I get scared, I'm aghast, because yes, there are still EMS providers who don't necessarily put on gloves. That worries me. What's worse is there are EMS providers who also don't put on safety glasses. I teach at one of the local paramedic colleges, and that's drilled into people now. And that's called, used to be called universal precautions, it's now standard precautions. So the thing about Ebola, though, is it can be aerosolized. So what do I mean by aerosolized? Little microparticles. So what type of procedures? Well, if you suction a patient, that's aerosolization. If you're doing bag valve mask ventilation, you can aerosolize it. But it's really, it coming in contact with the copious secretions, such as sweat, saliva, semen, blood, feces, urine, breast milk, etc. Ebola will not enter intact skin. It needs to come in contact with your mucous membranes, your eyes, your nose, your mouth. Now, if you have a big abrasion or break in your skin, yeah, it can do that. So this has been going on probably since December of 2013. The world community really didn't pay close enough attention for several months. And then mid-March is when it really took off of this year. This is the largest outbreak ever of EVD, Ebola viral disease. My personal opinion is people say, well, why don't we just close our borders? It's not going to work. Modern air travel. And it will continue to spread until the world community, our first world nations like the US, the European countries, need to send aid. It's a moral imperative. Now, comparing Ebola to the 1918-19 pandemic flu, this is kind of a sobering statistic. Between 20 and 40% of the world, yes, the entire world, fell ill. Worldwide, 50 million people, more than the entire state of California, died. We're talking the flu. 675,000 people, it's estimated, died in the US, and this is before modern air travel. So for those of us who don't think that if we don't really try to eradicate this current outbreak with public health measures are sadly mistaken. I want to give a big shout out to our public health colleagues because they are really becoming joined at the hip with EMS. So here's an estimate. Here are the graphs. So this is Guinea. And if you look, this is not a straight linear curve. This is logarithmic. Again, logarithmic. Liberia, logarithmic. Because of the poor infrastructure in healthcare, I think it's estimated, I think it was Liberia or Guinea, I don't remember which one, spent on average $100 a year per person on average. $100. So the CDC is estimating there are probably 2.5 cases for everyone that they truly identify. So again, we need to send aid. Now, the three countries currently are Guinea, Sierra Leone, and Liberia. And you say, okay, where is that? I knew that I was a little rusty in my 4th and 5th grade geography, and I think everybody else is also. Unfortunately, these three countries are among the poorest in the world, the weakest healthcare infrastructure in the world. Liberia had just survived a 13-year civil war with genocide. Their population has been through a hell of a lot. So it will spread. There was a 2-year-old toddler who died from Ebola, and she died in Mali. She took a 600-mile bus trip with her grandparents because her mother died in Guinea. So the World Health Organization has deployed boots on the ground trying to make sure that their infrastructure can help contain it. So here's Africa. It is a huge continent. I also work in Santa Clara County, and we've had probably between 6 and 8 Ebola scares, so to speak, where the healthcare providers were sure that this was Ebola. So if you look at this, here are the three countries. So we had one provider who was concerned because a patient from Ethiopia was running a fever and had diarrhea. We had now Nigeria did have an outbreak and they contained it. There have been 2 complete cycles, 21-day cycles, no new cases. And the same thing has happened in Senegal. Senegal was like the United States where they got an imported case. So here's kind of interesting factoids. When you think about the geography, and you just can't say, oh, well, they're from Africa. London is closer to those 3 countries than Johannesburg, South Africa, by about 500 miles. So you need to be specific. We're working on protocols to start in PSAPs, or public safety answering points. None of our PSAPs in NorCal counties do EMD formally. Now, Enloe does. They have a homegrown version, and Shasta County does. They have MPDS, big bucks. We do in Santa Clara County. I have not released them because what you're trying to do is have a tool that is very low yield because there's so few people, and you want 100% sensitivity trying to catch each and every one. The problem is the specificity is very low. So when you have a positive, more likely those are going to be false positives than true positives. So how do you tell? What type of risk assessment? Well, the big thing is, 1, are they running a fever? 2, have they been in Liberia, Sierra Leone, or Guinea within the past 21 days? Have they been in close contact with somebody who's been in these countries? If the answer is no, more than likely they do have an infectious disease, probably typhoid, or they have malaria, which is also endemic in those countries. And early on, the symptoms are very, very close. And the majority of people coming from these 3 Western African countries more than likely have those 2 diseases. Now, going back to that slide that showed the logarithmic exponential curves, left unchecked, if we don't do something, it's estimated by the CDC and WHO that there'll be 1.4 million, yes, 1.4 million cases in those 3 countries alone. Devastating. Whoops, wrong. Okay, so what type of symptoms are these people having? Again, fever, weakness, muscle pain, diarrhea, and vomiting. So let me talk about what's a suspected case versus a PUI, that's not POI, that's PUI, person under investigation. So if somebody has traveled and they have the right symptomatology, they can be a suspected case. In the North State, we don't have the healthcare resources that we do down in Santa Clara, so our health officers, we're fortunate. We have a health officer on call 24/7, 365. The majority of our health officers in the North State are not full-time. Now, Butte County has a full-time health officer, Dr. Mark Lumberg, great guy, Andrew Decker, the Shasta counties, but most of actually all the NorCal counties have very part-time health officers. So what will happen is the call will go out to the Mohawk, and thank you, Amy, Travis, for telling people what the Mohawk is. They will call the on-duty health officer / CDPH duty officer, and they'll work through this. And probably very quickly, using epidemiologic investigation tools and techniques, either say, yeah, this is a PUI or person under investigation, or no, they more than likely have malaria or some other tropical disease. As I mentioned earlier, we're starting to work on these PSAP screenings. It's difficult. It has to be very scripted. And if there are false positives, we really need to go back and figure out what the quality assurance or quality improvement needs to happen, because there will be false positives, just because the screening tools are blunt. So it starts again, 87% fever, chills, muscle aches and chills about 40%, weakness about 75%. By day 4, you're really starting to get nausea, vomiting, large amounts of fluid. day 5 to 7, they may develop a minor rash, and by day 6 to 16, they start getting multi-organ system failure. So their kidneys are shutting down, their lungs are shutting down, and these people are critically ill. Now, I've had several conversations with our local healthcare in the NorCal counties. They're all critical access hospitals. They're all appropriately planning in case in the unlikely event that they'll get a person under investigation. Now, I had a conversation with one of the chief nursing officers, and they were talking about, well, how many Ebola patients do you think we can handle at our facility? My immediate response was none. These are incredibly intense, resource-intense patients, because a critical access hospital does not have an ICU, does not have a blood bank, does not have an infectious disease specialist, doesn't have a ventilator other than a transport vent to get patients out. So they'll be stabilized and shipped. Now, the interesting thing, and I think is yesterday, UC System medical centers, Davis, Irvine, San Diego, UCLA, I'm missing a couple, San Francisco, all became priority referral centers for these patients. But the caveat is this is for confirmed cases. So it's not reasonable in my mind that these patients should stay in the Northstate. So we need to continue to push forward. How was Ebola transmitted? Well, it's initially thought to come from bats, fruit bats, and primates. And so the initial cases back in 1976 were thought to start what's known as a zoonotic infection. Lots of infections you can get from animals. This is one of them. And it was probably from eating bushmeat, which is not real popular, is my understanding, in the Northstate. Most people don't go and say, ooh, I think I want gorilla tonight for dinner. So you can get by direct contact, but you have to come in contact with one of their mucous membranes. So the screening and the PPE, or personal protective equipment, is really key. Now, fortunately, many of the NorCal counties have Tyvek suits, which is now one of the ways you can protect yourself, plus other pieces. We purchased, I don't know how many years ago, Larry and I, when we were working together on the HPP, or hospital preparedness grants. So a lot of the larger counties don't have the Tyvek suits because there's now a national shortage. What a surprise. So who's at risk? Healthcare workers who take care of these patients, home caregivers who take care of these patients, and then in Western Africa, the traditional funeral processes where they wash the body prior to being buried. And as has been shown, the infectiousness goes way up, because as the disease continues, the number of viral load and number of virus particles in your body skyrockets. And so somebody who's just passed away is probably at the highest load. So what's an incubation period versus the infectious period? Well, incubation is the time that you're exposed to the bug, and then you onset of symptoms. Again, 2 to 21 days. Infectivity for Ebola is when you can transmit it, and that's once symptoms start. So how are we preparing? Well, a couple of ways. Rapid identification of patients. Is it possible in the Northstate? Yeah, it is. My hat again goes off to public health's enormous job of contact tracing. The rapid implementation of these control measures, they did a good job in New York City. In Mali, they've already identified since yesterday 40 contacts from the bus ride. Where they'll be able to get every contact? Probably not. So, is it safe to transport these patients via EMS to local hospitals? Well, you may have no choice. I will start into discussions with each of the healthcare facilities within the next month and public health. Do we try to transport these patients to a tertiary center? So if you're in Trinity County, for example, do you go to Trinity, the hospital in Trinity County, or do you just go straight down the hill to Mercy or SRMC? I think that's going to be played out. I personally think that if we start designating referral centers, then many of the statutory regulations will be eased. The same way that if you're having a big heart attack, a STEMI, you're having a stroke, or you're a trauma patient, and you don't stop at the local hospital, you go straight to a trauma center or a stroke center or a STEMI center, this may happen. It's really up to the California Department of Public Health and our local health officers to push the issue, and I really encourage them to do that. Again, I mentioned already about the UC hospitals. Talking about air providers, if you think that somebody's going to take their $10 to $12 million bird and transport an Ebola patient, I think you're sadly mistaken, because I don't think that's an appropriate use of that resource. Again, regional centers, it's up to the city and the county local health officers. We'll talk a little bit about decontamination. The CDC has really adopted Doctors Without Borders, and so is decontamination prior to doffing or taking off your PPE. This will require the hospital's help. You'll need buddies, and they're talking about observers. The other thing that's going to be difficult for the North State is if you do happen to get an Ebola patient and you transport them to the local hospital to a referral center, Cal OSHA and CDPH and EMSA say the provider should not, let me repeat that, should not decon their own vehicles. It needs to be done by a hazmat crew. So, in Trinity County, how many ambulances does TCLS have? Anybody here from Trinity? How many rigs does TCLS have? 3? So imagine that one of them's gone. It's a giant paperweight now. Because what we're doing in Santa Clara is we're telling the crews to leave, isolate your ambulance, lock it, and walk away and decontaminate yourself. Take your PPE off. Now in Santa Clara County, when we have 55 ambulances on the road each day, one ambulance is not a big deal. If a third of your fleet's gone for a week, that can be a big deal. So these again are issues that we need to work through with public health, the hospitals, and EMS. So risk preparedness, risk communication is huge. My recommendation is send them to public health. I personally shun the media. I run in the opposite direction. I like being behind the scenes. Or if your agency has a public information officer, send them that way. So again, it's the risk identification, stop the train of transmission. Can be done. So PPE, the new guidelines that came out on the 20th. The double glove technique, eye protection for this high-risk patient, it's not eyeglasses, it's goggles and face shield. N95 masks or P100 particle respirators for any invasive procedure. Fluid impermeable suits or fluid impermeable gown ensemble, which is multiple different pieces. The booties, the leg waders, the impermeable gown, etc. The bottom line from the CDC is no skin showing. You got to practice with PPE. It's very deceptively, it looks easy, but it's deceptively difficult not to contaminate yourself. And anybody who's ever worked in a Tyvek suit, I remember one exercise that Larry and I were doing in Tehama County in Red Bluff, and it was 101 degrees. I lasted 15 minutes inside the suit. They couldn't get me out of it soon enough. I was in a positive air powered respirator. Oh, it's terrible. Again, donning and doffing practice with a buddy, trained observer. We're recommending bleach 0.5% and a dwell time between 5 and 10 minutes. Dwell means just the contact time. So who here wants to know the secret recipe for making 0.5% bleach solution? Nobody wants to know? It wasn't a rhetorical question. It's really tough. Go to the supermarket, buy a gallon jug of Clorox or the generic brand, take 1 cup, or if you want to make some for your buddies, 1 gallon of bleach, add 9 gallons or 9 cups of water. Presto, you now have the appropriate bleach solution. The nice thing about bleach is it kills everything. Who here is concerned about MRSA? Okay. Takes care of MRSA. Who's here worried about VRE or vancomycin-resistant enterococcus? Takes care of that. Who here is really concerned about Clostridium difficile? That one's not very pleasant. It also kills C. difficile. The thing that you want to realize is the alcohol-based hand sanitizers don't work on C. diff. C. diff goes, eh. So, onward and upward. So here's where the controversial part happened. Yesterday, Governor Cuomo of New York and Governor Christie of New Jersey mandated quarantine for 21 days for all people returning from those affected African countries, including healthcare professionals who had contact with Ebola patients. My understanding is the Health Commissioner of New York about flipped out. Mayor de Blasio of New York City is pissed off. I think it's a little overkill. However, the North Carolina-based international relief group Samaritan's Purse does do that. The nice thing, though, is they put you up in a nice place right near, within a mile or two of the NIH hospital or Emory, and they pay you full salary for 21 days. Hey, what the hell? The Obama administration said they were weighing the dilemma. The big thing, though, is it's going to make relief workers harder to get them, because now if you're there for 3 weeks, you're going to be home for 3 weeks and not doing anything. Not many people have 6 weeks to just, okay, I'm out of time. Fortunately, that was the last slide. Thanks. Are we going to do any questions, or I'm just going to hang out in the back? Take 1 question. Okay, I'll take 1 or 2 questions, and then we got to give the raffle and break, and I'll hang out in the back, whoever wants to ask. So, any questions? Yes, sir. It's a 1 to 9. So if you use 1 cup of bleach, 9 cups of water. 1 gallon of bleach, 9 gallons of water. It's the dilution of 10%.
Household bleach is 5% sodium hypochlorite.
5.25, please.
Before he was a doctor, he was a chemist.
Okay. Yes, ma'am.
Just wanted to comment, not all bleach is that currently. We have some that you buy a big lot that's only 3%, and then they have this super that's 8 stuff. You really have to follow the correct container.
You can tell how often I now go to the supermarket. I was not aware of the 8.8% and the 3%. Why can't they just leave well enough alone? Okay.
I have the last question. Did you know Howie Mandel had copied your haircut?
No, I did not.
All right.